of kids who are now a little older than you. They're in their high school years, but I remember vividly the just the energy you guys bring to being together with each other, and the energy you bring to studying. And I'm hoping I can pique your interest in the kind of stuff that I have a chance to do. I have a chance to hear about this because of my school. Alumni told me that there's a chance to share with you guys. And I serve on another organization that's related, the Palo Community Fund, that is funded by an organization that helps fund you guys. The organization is sponsoring this morning. So I'm just really excited to be joining you guys. I also am on the board of my children's school, so I know how much how much changes you guys have had to deal with, and how much energy your teachers and your principals are putting into keeping you guys safe. And I want to speak to that a little bit. So I'm a family doctor. You guys all have you have your regular doctors that you go and see, and when you were younger, you had to get shots. Now you just go and you get checked up and make sure that you're on track with how you're doing. I'm that kind of doctor. The way I got here was that I really loved learning about taking care of people when I was young. I'm sorry about the plane noise. When I was little, I just loved helping people. And if I thought of different ways that I could help take care of other people, I had a chance to see that in action with my own parents were in healthcare, and I got a chance to learn a lot about different ways to help people using healthcare through a program that you guys soon will be able to have a chance to. The 8th graders soon, once you turn 14, I'm advisor for Medical Explorers Post 751 through Valley Medical Center. It's a scouting program that's a Boy Scout program, but is largely young women that are interested in healthcare. And they have a chance to learn about healthcare. And I want to give you just a peek of the kind of things that I spoke to them just last night about all of the different scouting kids interested in medicine all over the Bay Area, just like you guys are. So because I was so passionate that I really liked helping people when I was little, I thought that I would really want to learn as much as I could about taking care of people when I was in high school. So I volunteered through that scouting program. I volunteered and I got a chance to shadow. What it means to shadow someone is that if you guys have ever had the chance to do the follow your parent to work day, it's kind of like that, but for a lot of days. And it oftentimes a way to follow different kinds of people in healthcare, doctors and nurses, and in different environments. So I got a chance to see a lot of different places. And so I wanted to encourage you guys that if you guys have a interest in whatever it is you love to do, if you can ask, a lot of times the people who you ask, you may find that they're too busy, but if you keep on asking, you may find someone who has the time and energy and sees the passion that you have in what they're doing and would love to have you on. And so it may take many times to ask, but you can, a lot of times, if you really want to try and learn about something, you'll find somebody who wants to take the time to be able to share that with you and let you come and see that with them. And so I had a chance to do that when I was in high school. And that chance led to 500 hours of volunteering in high school in different places. And that showed the colleges after high school, after you guys finish high school, the way to get to be a doctor is to go to college and medical school. And I was so passionate. I really liked medicine so much that I showed that I could, that I had that love for taking care of people that way. I got into a 8-year program that combined undergrad and med school at Brown University, a school over in the East Coast. On the other side, you know, we got this West Coast ocean here. On the other side by the Atlantic, it's all around the northeastern corner of our United States. And so I had a chance to do that. It's a lot of studying to do because you know how complicated the body is. And so to learn and find out how to take care of all the different parts of the body takes a while. And so it takes 4 years of college and then 4 years of medical school. And if you can believe, after 8 years, imagine all the time that you spend in elementary school. That's not enough. Just like you guys have to do high school, it takes another 3 years of residency at least. And for my example, 3 years for family practice, to have the chance to come out and work as a doctor, because those couple of years, like you guys have high school where you're practicing a lot of what you're learning now in elementary school and learning more, is the same way in residency, where I had my hands-on training in doing everything I learned in medical school and learning more while actually taking care of people under the supervision. Just like your parents help supervise you and your teachers help supervise you, those 3 years I had a chance to get supervised and make sure that I knew how to take care of people well, so I could come out and have a job. That first job that I had after residency, after family practice training, if you can believe it, was a job maybe more like one of your parents. I joined a startup. And it's like, what would a doctor do in a startup? Well, it was an electronic medical record startup. You guys may use the internet for different things, mostly probably to watch TikTok videos and YouTube videos and things like that. Well, that same computer can be used to record and write down stuff about what you're doing, just like you can write down stuff in email and send it to each other. Well, the same kind of programs can help doctors write down what we do and also order, meaning tell the other people on our team what to do and how to do it safely. And so I worked in a company to help develop that. We went public. The company was bought and closed our office. So I came back to practicing medicine. I practiced at Palo Alto Medical Foundation, which is our Sutter affiliate here in the Bay Area, for almost 20 years. You guys may actually have doctors, pediatricians that are at PAMF, because we're one of the largest providers of healthcare. But along that while, I volunteered in a homeless clinic right next to my clinic and realized I had a real passion for helping people who didn't have houses. And so if you can see, you were wondering, why am I out in this outdoor environment? And it's because I followed my heart after those years in a regular practice like your doctors have, to go work for the county. So the Santa Clara County you guys have a town that you live in, a city, and then America is organized into counties, and that's an area smaller than a state like California, but it's larger than one city. And so each county is responsible for taking care of the people who don't have a way to have other ways of getting help. And so I decided that I would move from a regular doctor's practice like your doctors, your regular pediatricians, into helping in a place, the county, where I can help people who don't have other ways of getting help. And so I was first in the emergency room, and then now I've moved over to urgent care. You guys, I hope you've never had to be really sick and end up in the emergency room. If you do, that's a place where people who are possibly dying end up. And so I helped people not die in the emergency room. After doing that for 2 years, I moved to another place that you guys, this place you might have gone to, because when your doctor's not ready to, oftentimes if you have something really urgent and you can't wait for your doctor to have an appointment in a couple months, well, I work now in a place called urgent care. And an urgent care is a place that you can just walk into and wait for a doctor to see you. That's the place where I am in South San Jose. And it's a place where people can walk in for free, even if you're not a citizen or if you don't have health insurance like you guys have through your parents' insurance companies. I help take care of people who don't have a chance to have that kind of support based on the work that they are able to do. And so they can just walk in and I can help them and take care of them. And it's the hard work that your parents do that it supports that, by the government taking a little bit of that in something called taxes. And that little bit of the part of the work that your parents do helps pay for people who can't get help. So I wanted to share with you that there's a way for people who sometimes you can see out that you may pass by and see, I wonder how they can get help if they can't, if they don't have any money and if they don't have any work to support them. Well, there are people out there that are paid by the government to help, and I joined those folks to help them. During the day, from noon to 10 each day, I help manage some doctors and nurses that work and help care for people who walk into my downtown East San Jose clinic. And then on some mornings when I have time off, or like today, I've got the whole day off, I come out, I throw on a backpack full of medicine and join a couple other doctors and nurses to help out people who are homeless in woody areas. And I've just left them for a little bit to share with you and talk to you guys about taking care of them. Because some people who don't have houses, they find the next safest place to be is along a creek side or in a city park where they won't be chased away. And if they get sick, then we try to come out and help them. And you may wonder, why would anybody care about people who are like hiding from other people and camping out? Well, a lot of times they've made that choice because they're sick with the chemicals in their brain. And sometimes those choices that they make not only possibly hurt themselves, but other people, because if they get sick, they can spread things to other people. So the taxes, the little part of your parents' work that goes to support this, helps keep the whole community, everybody, you guys, your parents, everybody around you safe. And so that's why we go out and help people here out on the creek sides. When they get sick and they can't stay in their tents out here, we offer them the chance to move to shelter. You guys may not know, but your parents, some of them probably love to go to conferences and conventions. And right now that's not happening because of the outbreak. And so the county has turned a lot of those convention centers into places for people who I'm taking care of right now, for them to have a safe place to stay and recover from their illness. If this sickness, if the way that they're not feeling well is something that could go and make somebody else sick, then we sometimes move them from those shelters to individual motel rooms, and they are able to recuperate in a private place, because we don't want the thing that they're getting sick with to spread to other people. And that brings me to the outbreak that's going on right now. This is something that I've really cared about. I've helped with abroad. I go regularly to different disasters across the world. Every major disaster that has happened in the last decade, I've had a chance to bring doctors and nurses. People have rallied behind me and said, "Go, Enoch, go, bring these doctors, bring the medicine, help them when disaster happens." And those disasters were things like the flooding that we had in Katrina in New Orleans, if you guys were little kids and heard about that. Then the earthquake in Haiti about 10 years ago. You guys were probably really little then too, but it was their biggest disaster nearby where we are. I brought doctors and nurses down there. More recently to Nepal, where they had a big earthquake, in Japan, where they had a big wall of water that washed away a lot of things. And the same thing happened to the Philippines. Well, we've had our own disaster here, and it wasn't from something that Mother Nature caused, but it was something that spread among people. And since I'm someone who helps take care and help people get better from things that are making them sick, I'm in a place where I'm helping with that now. Every day, I help test for people, letting them know if they have the virus that you guys have heard of, that has made your life so different right now, that has made you have to sometimes maybe stay home rather than see your friends at school together, or maybe be at camp together. And so instead you have a chance to meet maybe in smaller groups rather than your big classes. It's because there are rules around getting together to help stop the spread. We've done really, really good really well in this area at not having that virus spread from person to person, because we've been really careful about, I've taken off my mask to talk to you because I'm not within 6 foot of anybody else, but you can see this is the mask that I wear to be able to protect other people as well as protect myself. And in our area, we've been really good at keeping the rates of the virus spreading from person to person because we've followed the instructions well of wearing masks and staying home when we can, and been sad not to go and see our friends, but protected ourselves and our family and other people by staying away right now. That virus is something that's going to keep on affecting us right now. The amount of virus spreading has been increasing, and so it makes it even more important that you guys follow the instructions that you guys are. It's so hard when you're young to not play with your friends. I know because I have kids who are high schoolers now, just a little older than you guys are, and I know the one thing that they love, that they want to do more than anything else, is to be with their friends. And it's really hard, but by following the instructions, you can help protect yourselves and other people, and protect your parents and maybe your grandparents if they stay at home, because although you guys are really unlikely to get sick, really sick, if you catch this, you guys, almost all of you would be fine if you did catch it. It's just that older people don't do as well. And I know how much you care about your parents and your grandparents. And so they can't stop caring and loving you. And so you can help protect them by staying safe and not catching this virus, because it can hurt them more than it can hurt you. So I'm so glad that you guys are able to keep on seeing your friends like you see your friends on this Zoom today, in a way that keeps yourself more than 6 feet apart from other people for more than 10 minutes at a time, which is the time that it takes sometimes for the virus to spread from person to person. So I wanted to just share all those things and open it up to questions. If you guys have questions about either the virus or about the kind of places that I work or the way that I was able to get here, I'm happy to share any parts of that, or about my international volunteering. I'm happy to answer any questions from any of those parts. If there's something that strikes your interest, I'm happy to share that.
Thank you so much, Dr. Choi. So can you see the hand raise function if people raise their hand on your phone?
Let's see, I can go to participants and I don't see any hands raised. Let me see.
So typically raise your hand if you have a question, and then just unmute yourself and ask, and he'll probably see that. Or just jump in. There's been a lot of misinformation about COVID-19. This is a really great opportunity to get really good intel on what's going on. So go for it.
Really, I would like all of you guys to at least ask a question. This is a really great opportunity. Like if you are curious, this is a time to ask an expert about COVID-19. So please like ask those questions, because in the news we get so much information on Facebook that it's overwhelming and we don't know like what's true and what, you know, and what's not. So this is a time, ask the questions. I know that all of you have questions.
And I also know that a few people in 8th grade were talking about becoming a nurse, or thinking that that might be one of their goals for the future. If it is, I think something to ask about the medical. If you have any questions about the medical field, this is a great time to do that as well.
Okay, looks like Sitali has a question. Happy to answer Sitali's question.
Can we ask questions about like anything in general, like related to the medical field?
Yes,
Okay, so,
any.
I actually want to become a nurse practitioner when I'm older. So I just wanted like to know more from someone in the medical field's perspective on like how to achieve that.
Sure. I actually supervise, meaning I help not only supervise or manage doctors that take care of patients, but nurse practitioners. And so I can tell you about that. Some of my favorite people are nurse practitioners. The way that they've gotten where they are is that they have become, after high school, they become a nurse. Some of them without going to college. There's nursing school. Some people go and get their college degree, but some of them just get their what we call an associate's, which is just the first 2 years of college, and their nursing degree at the same time. Once they've worked as a nurse for a short while, they decide that they want to do more than, which is the work of a nurse is wonderful. They follow the instructions of doctors on how to take care of patients. And but some nurses find that they would like to be able to decide on those orders themselves. And so they go back to school and they finish a few more years of training to become a nurse practitioner. Those people, after they finish their training, they can get a job in a role that is like a doctor, in that they can make their own orders. They can decide what is right for a patient and order that to be done, either for themselves to do it or other people who are supporting them. Other nurses or medical assistants can help carry out those orders. And the difference is that between a nurse practitioner and a doctor is that the nurse practitioners are oftentimes decide that they have a specific, really more narrow interest, and they really like, say, the disease called diabetes, which is too much sugar in your bloodstream, or they like helping take care of people with wounds. You know, if you get a cut and you need to be healed of the cut, they can help focus on that. So oftentimes a nurse practitioner finds a more narrow, meaning a more limited number of things that they like to focus on, and then they get a job in that, rather than in medicine. We get training in to be able to do more things, and we have more opportunities to do greater variety, meaning many more different kinds of things, because we've had a chance to learn how to do more different things. But I wanted to really encourage you to explore the differences, because you can spend a lot less time becoming a nurse practitioner, and it's a really different route of the kind of schooling, and it can be much less expensive. So that's one factor for many people, that they find that they can't afford the loans, or they don't want to take on the kind of loans of medical school, or they may not actually get accepted because it's much more competitive, meaning you have to fight with other people, many more other people to get into medical school, compared to getting into nursing school, which is more, it's less competitive and easier. Most people that really love the caring for people like a nurse, they can usually find a way to afford and also get into nursing school, because it's less people you're fighting against to get into. So it's a route that you can get to do things a lot like a doctor, with a lot less time and less expense. It's less costly, but you may be able to do less kinds of things that a doctor would do.
I have a question. Oh, sorry, Siklali, go ahead. Oh, are you done, Siklali? Okay.
I just wanted to thank you.
Got it.
You're welcome.
I have a question regarding COVID-19. There's like so much information out there, you don't know what's true. So if I go to the grocery store and I buy items, is it necessary for me to wipe everything down, or is that something that we're just going like a little extra, or?
We think that it is a little extra. So initially we were very concerned that COVID could be spread on surfaces. And we still recommend that surfaces be wiped down with a cleaning solution. One option is a greater than 60% alcohol-based solution, or otherwise a diluted bleach solution. That's something that, for example, in a place where we see a lot of COVID, we wipe down our surfaces twice a day with those kind of solutions. But the current recommendations, my understanding is that we don't believe that you need to do so for items that you've purchased in the general public. We haven't seen COVID spread in that way, even though theoretically it could be. So we think it's a little extra. Some people who are really concerned, what they do is they leave something out for if you don't need to use it for a few days, and just the exposure to air is enough to break down the virus. And we don't think that's necessary, but that's one option that people have done, but it's not thought that you need to wipe things down right now.
And then if say that we're going for a walk and there's no one around you, should you still be wearing a mask, or is that something that you can carry with you and just put it on when you come when you encounter a large group of people? Or what is like the recommendation when it comes to mask? When, like, do we just wear it when we're working out, or yeah?
So masks are very controversial. You can see the mask that I have on. You should follow your county's recommendations. And as I believe that all of you guys are in Santa Clara County, our county's recommendations are that we wear a mask, and they've really stressed that when you're out because it radically decreases the spread of the virus from person to person. It protects other people. The masks, just any kind of cloth that you cover your mouth with may not filter the viruses that you breathe in. If you're within 6 feet of somebody who doesn't have a mask, then if for more than 10 minutes, if they have COVID, that is a risk to you. But by wearing a mask, if you have it, you radically reduce the chance of giving it to somebody else. And so that's why the current county recommendations are, even if you're out and about, by wearing a mask, when you pass within 6 feet of somebody, you drastically reduce the chance that it would spread. And we think that that's a big factor in why many countries have been much more successful in controlling the spread of the virus. And so it is recommended.
All right, thank you so much.
Yeah.
What else are you guys wondering?
Do you want to hear about what it's like to get tested?
Sure.
Because there's we're increasing testing a lot in our county, because we're worried that there may be as much virus spreading soon here as there is in some other parts of the country. If you guys have family or friends in other southern or southeastern states, you might have heard how much is spreading in those places. So we're testing more and more. And the process of testing is that if your parents are worried that either you're having symptoms of feeling hot, feeling chilly, having a little shortness of breath or cough, losing your taste or smell, having vomiting or diarrhea or belly pain. Some of these things, some of these symptoms, the ways that you feel bad. So when people worry that they have COVID, they can get tested for free. They just, the county is one place that they can get that, but there's a lot of places that you can get tested. The process now is that you make an appointment and then you drive up, they put a swab. Have you guys seen a Q-tip? It's like a Q-tip, but a long stemmed Q-tip. And they wipe it around the front of your nose. You might have heard from people that it really stung and burned because they had to stick it way back in the back of the nose. Now we can stick it just in the front and wipe it around the front of the nose. So it's a lot less uncomfortable. So I hope you guys don't pick your noses, but it's kind of like that feeling. And it's a lot more comfortable because it's a lot smaller than your finger. So it's really easy. It doesn't hurt at all. It's not like when you had to get poked for a shot at your doctor's office. It's not like if you've ever had to have blood taken out of your vein for any tests. It's just like brushing against your skin a little bit inside your nose. This is really easy. And in a couple days, if you're positive, they'll call you and say, hey, you should stay home for 2 weeks. And until a week after, you don't have any more symptoms. If you're negative, usually you get a letter, and that tells you you can go back out after 3 days after you don't have any more symptoms. So that's the process of getting tested. And some of you guys may have that experience coming up soon, because we're starting to test even people without symptoms, because people who've had contact with other people with COVID, we want to keep them home in case they have. Some people have COVID and they don't have any symptoms. We've found many, many people like that. So some of you may go and say, why is my mom and dad making me swab my nose because of this thing? I don't feel bad. It's because you might have had a contact with someone that you didn't know, but the public health department tells your mom and dad, hey, everybody here needs to go get tested. And so you might have a chance to do that even if you feel well.
I went and I got tested about like 2 or 3 weeks ago. There's a lot of Santa Clara has a lot of places where you can just go make a line and then you get tested. And it was really, really simple. Like you form the line. I think it opened at 10 and I was in line at 8 in the morning because it gets really long. And then once you get in there, they just like put the little swab up in your nose. It doesn't even hurt. You obviously have to be wearing a mask. And then a few days after, I got an email saying that it was negative for now. So it's important to like keep on checking, especially if parents are working or someone in your home is going in and out. Get tested. You can get tested as long as you go with your parents as well. Every week there's new sites available for people to go get tested, which I think it's something that we should take advantage of because it's available right now and we have the tests. So if your parents want, that's something that I can give you information about as well. And I do encourage everyone to get tested. I think that's the safest things. Yeah, at least my opinion.
It is. No, that's a good opinion. I agree that if you have any concerns, because people can be sick without having any sign of being sick, it's very worthwhile to go get tested. We have lots of availability to get tested, and so I would recommend it.
Yeah, when I went and got tested, I asked oh, have you guys gotten any positives? And they're like, yeah, it's usually people who show no symptoms and they come out positive. So they are a lot of I forgot the name of that. It's what they're called.
Without symptoms, asymptomatic.
Yes, asymptomatic. So there's a lot of a lot of people who may have the COVID-19 but are showing no symptoms whatsoever. And then if you go to the store, or if you're if someone comes by and drops something off and you're in contact with them, it can easily spread to them if you're not wearing a mask and they're not wearing a mask. So it's better to go check and be safe than not knowing, because sometimes we don't show any symptoms and you may have it. And I'm saying that you may have it, but others, yeah.
That's right. It's a really good way of thinking. So I agree.
I have a question for students that may be interested in going into the medical field. What classes or what activities should they be doing in high school besides pursuing volunteer opportunities and shadowing opportunities to make sure that they have a good background for knowledge about the medical field, and also so that they're strong candidates for pre-med programs?
Excellent. Yeah, that's a great question. So I mentioned, I think earlier about, I have been, when I was a high school student, I was part of Medical Explorers, the Boy Scouting program. Instead of going towards becoming the Eagle Scout, you can do more of a subject-related scouting program, exploring. And the part that I was in was called Medical Explorers. And so we got a chance to shadow doctors and nurses and all different kinds of people. Through it, I had a chance to do all that volunteering, many hours, and I demonstrated my interests. What the medical schools want to see is that you've had a real commitment by the demonstration of the number of hours that you've devoted to that interest, that focus. If you really like somebody, like you've got a boyfriend or girlfriend, you spend a lot of time with them, right? So the same way medical schools want to see that someone who's in the pre-med track has spent a lot of time devoting time that they could otherwise be hanging out with a boyfriend or girlfriend or watching a movie or something, instead pursuing this interest and focus. So other than doing shadowing, which is tough to get right now. So my daughter, since she hasn't been able to shadow, she shadowed me through the Valley Medical Center of the county until they because of COVID, they're not allowing any non-patients in the hospital anymore. Now she, once you turn 18, she trained to be a paramedic. And so she's in EMT school right now before she starts college. And so by getting a job in medicine, that demonstrates your focus and your energy. Evenings off from school and class, she can ride in the ambulance or drive the ambulance and pick up people who are dying to bring them to the hospital. Other people can possibly get jobs as medical assistants because the training is shorter and easier. So I think the course of demonstrating your interest in shadowing opportunities are less now. Maybe more towards actual filling roles and actual jobs, whether it be becoming a medical assistant or going to help. If you have a doctor that you grew up with, you can ask them, hey, can I volunteer in your office and help file, be away from patients, but just do some filing for you. I did that for my dad when I was in high school. Whatever it is that you can do to show your demonstrated interest. If you have an opportunity to participate in research and be part of a paper that's published, that also shows interest. That's easier to do in college, but if in high school you have a chance to do that, that also shows a lot of your interest. And whatever you're really passionate about, showing that you had so much passion that you could lead your group in that passion. So showing student leadership in the organizations that you really care about are ways that can really help. Also, when you go into training, the kind of people that you're going to take care of are the underserved, kind of the people that I'm taking care of full time now, the homeless and people without insurance. So the more you demonstrate that you have a compassion for taking care of people like that in your volunteering and your efforts, shows the schools that you have a heart that is in line with the kind of work that this is, which is listening and attuning and connecting with people at sometimes their worst. They're just really hurting, and it takes a certain amount of patience and willingness to connect with people like that. And so medical schools also want to see that you have the right kind of heart to want to listen to people's problems and offer them the compassion and encouragement and the hope that they'll get better with the ways that you have to offer them in terms of medicines and exercises and other ways to get better, and to offer people that hope so that they can feed into your care, your empathy, your connection, and your expectation that they're going to get relief of the way that they're suffering. So they want to see a number of things. And so those are some of the kinds of things that they want to see, other than just excelling in your studies. They also want to see that you have done very well with your schoolwork and the tests that it takes to get into medical school, which is kind of why, that sounds like a lot, especially to some young person who's maybe in 6th to 8th grade. But you have plenty of time to be able to do all of that. So I just want to reassure you that don't feel like that's all really daunting. If you guys follow your passion and do what you really love to do, the universe ahead of you will see your passion, will see your energy devoted towards that, and you'll find a place that is perfect for you.
Thank you so much, Dr. Choi. Anybody have any last questions? Going once, going twice. All right, thank you so much.
I'll have just a parting thing. In this time where a lot of you I know my kids are they feel really sad about a lot of things. They're missing their friends. They're disappointed that people are telling them to do stuff that they don't want to do. They don't want to stay away from their friends. They don't want to, it's a summer. I want to be at Raging Waters. I want to be at Great America. I want to be out and, enjoying things. I just want to encourage you that this is going to be better. In another year, we're going to have some medicine that will protect you from this. We have a lot of ways that scientists are working really hard at protecting you. And although things are really, really hard right now, it's going to be a lot better, hopefully in about a year, because we have a lot of early signs that we have good medicine that will help protect you. Vaccines are under development, many, many of them, and we're expecting that one of them should have a way to help. So although things are really hard right now, and you're really disappointed, I love going with my kids to water parks and bringing them to Disneyland. And Disneyland's not open, and Disney World is open right now, but Hong Kong Disneyland's closing today, and things are just so hard because the things that you love to do you can't do right now. It's going to get better, and we're developing medicine to help us all safely get back to all the things that we love to do. And until then, the one thing we can do is follow the instructions and encouragement so that you can stay well, so that we can be around to enjoy the time that we can do everything that we want to do again. So I want to encourage you that this will be better. It's just right now it's really hard. And I want you to know that, sorry, somebody tried to call me, that it's going to be better, and that it won't be so hard as it is right now. But the more you can follow your teacher's instructions, your parents' instructions, and stay healthy, the sooner you'll find, oh my gosh, I can't believe there was that year that we couldn't do anything. We had to stay home all the time, and it was really sucky. But it'll be better soon. It'll just take a little while before we can be better.
Thanks again. Teachers, can you let your students know where they're going to go next?
Yes, so 8th grade, you are going to go back to our old Zoom link, and I will give you further instructions there. I just want to make sure everyone is already set up, ready to go before we continue. So go back to our the Zoom link that you usually go on when we start class.
Same thing for my class.
Same thing. Sorry, Miss Anusha. Same thing for the 6th graders. Go back to the link that you use in the morning to access our Zoom class. Thank you. Thank you, everyone.
Stay safe, wear your
Thank you.
mask, stay inside.
Thank you.
Troy.
Thank you.
Bye.